Welcome to our phone tip today on how to place callers on hold. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we have trained more than 3,500 veterinary staff in both the United States and Canada. And I'm going to share a couple of quick tips with you today on placing callers on hold. So let's get started. One of the key things to remember is that when someone calls your veterinary practice, they're probably calling to either schedule an appointment or they may be in a bit of a panic because they're experiencing a medical emergency with their pet or unsure if they need urgent care and are really looking for your expert advice. So one of the key tips to remember is to always ask for permission and then wait for the answer before you place a caller on hold. So what I like to do is have you answer the phone with a very friendly, warm, compassionate greeting. And you're going to say the name of your hospital and then, of course, your name. But then you're going to ask the caller this question. Is this a medical emergency? And the key phrase here is in red. Or are you able to hold? Many people can hold, but of course, if their cat stopped breathing, they can't hold, and you really need to give them some immediate medical instruction over the phone, and of course, how to quickly get to your veterinary hospital. Another option might be that you are simply helping someone and you're trying to finish up and you just want to put the call on a brief hold. So I might, after I do my standard greeting, is then tell the caller I'm finishing checking out another client and then I can help you. Are you able to hold for a moment? And the key again is to always wait for the answer. Let me give you a very common scenario because I think sometimes veterinary receptionists are the world's best multitaskers because oftentimes they're juggling multiple ringing phone lines and people checking in and checking out, and there's lots of busyness in the lobby. So if you are at the front desk and you're currently checking out a client, but the phone rings, you do need to try and make each person feel equally important. So what I like to do is say to the client who's visiting today, will you please excuse me for a moment while I place this caller on hold so I can keep helping you? And again, I'm just going to tell her key phrases here like the word moment, knowing you're just going to step away for a few seconds and then keep helping you really shows her that the priority and emphasis is on serving her. When you answer that ringing phone, your goal is to simply put the caller on a brief hold and get back to helping the visiting client. So you're going to do your standard greeting with your hospital name and your name, and then you're going to ask that caller, may I place you on hold for a moment while I finish helping another client? And again, the word finish tells her it's just going to be a brief hold time. Let's say that you're on the phone, so different scenarios. So before we looked at visiting client and ringing phone, now let's say we've got simply multiple phone lines ringing. So let's say that you're on line 1 and line 2 is now ringing. You need to put line 1 on a brief hold. So I'm going to let that person know, are you able to hold for a moment while I put another caller on hold so I can keep helping you? Remember that when people are on the phone with your veterinary hospital, they can't see you and they can't hear also the other ringing phone lines. So you need to give a little bit of explanation about what's going on. Again, letting her know it would just be a brief hold and then you're going to keep helping her. When you answer that line number 2, you're going to do the standard greeting and then ask that caller also for permission to hold. Are you able to hold for a moment? I'm finishing helping another caller and then I'll be right with you. Now, whenever you pick up a call, make sure you reintroduce yourself, especially because there may be 2 or more people working at the front desk and one person may have put that call on hold and a second is picking it up. So always reintroduce yourself as well. I like to use the phrase, thank you for your patience. This is Wendy. How may I help you? And I like the phrase, thank you for your patience, rather than thank you for holding, because I just simply think that phrase has a little bit of negativity where thank you for your patience sounds very positive. So I hope you've enjoyed our tips today on how to put callers on hold and have great phone etiquette in your veterinary practice. You can get additional videos and tips on our Facebook page, on YouTube, and you can also follow us on Twitter. So make sure you have that smile whenever you answer the phone and use great etiquette the next time you put a caller on hold.